What the heck is the pelvic floor and why should you care? That is the purpose of today's video. So welcome, I'm so glad you're here. This is specifically information for teens and young women who are interested in learning more about this part of their body. So maybe you're not interested, maybe your mom told you or somebody in your life said, you should really watch this video. But I can promise you're gonna learn a lot today, and it's really, really helpful information that's gonna help keep you feeling really good, really strong, and pain-free for the rest of your life. It's gonna protect you in so many different ways for the rest of your life. So watch this now so you can prevent problems down the road. My name is Dr. Brianne Brogan. I'm a doctor of physical therapy, and I've had mothers and grandmothers and people reach out to me from all over the world saying, I need you to make something, to create something for the young women in my life who I wish knew this information that I didn't when I was a kid. See, so many women, including myself, didn't know this information when we were your age. And if only we'd known it, we could have prevented so many problems down the road, like peeing our pants after having a baby, or peeing our pants when we're laughing, or having issues where things kind of shift and change in our pelvic area when we're older. These things can give us pain, they can make it really hard to exercise, and they can make it hard to have intimate relationships with our partners in our lives. And so there's lots of reasons why you want to think about protecting this part of your body now so that you can really, really be comfortable and safe and happy well into the future. So let's get to it. We're going to talk today about basic anatomy, where these muscles are, what they do, and simple ways to protect them. So we're going to get right into it. There's no shame. There's no secrets. I'm gonna lay some stuff out on the table. I'm gonna talk about some things that you might not have talked about with other people in your life, going to the bathroom things, period things, stuff like that. So let's just get started. We're gonna begin with anatomy. So place your hands on your hips. I hope you'll join me in standing up. That really makes it the easiest, is when you put your hands on your body. And actually, that's the very first thing I want you to know. If you hear nothing else from me today, it's that this, your body, is your body. You are the one who should know it best. And so placing your hands on your body and touching the parts of your body that we're talking about is gonna help you feel more ownership and more power over this part of your body. So let's go ahead and do it. You're gonna know more about your body than your doctor, your partner, anybody else, okay? So hands on your hips, and I want you to place one hand in the front of your pelvis. Now I'm gonna show you what I'm talking about here. This is your pelvic bones, your pelvic area. So place your hands on your hips, and then one hand in front on the pubic bone, and one hand on the back on the tailbone area, okay? Let's go ahead and do that together. So hands on the hips, one hand in the front, one hand in the tailbone. Now between the front and the back hands is where the pelvic floor muscles live. They live like a little hammock that kind of scoops between those two areas. These pelvic floor muscles are right here on the pelvis, right in here. I'm going to show you from the inside. This is looking down in, and then if you want to see what it looks like from the outside, from the underneath area, there's an outer layer of muscles that surround the urethra, which is the tube that takes your pee out of your body, and also the vagina, and then the anus. So this is the outer layer of pelvic floor muscles, and this is the deep inner layer. And you can see they span from front to back, and also from side to side between the sitting bones. So let's go ahead and feel that now on your body. You can actually place your hands on your butt, and you can sit back a little and feel the bones that kind of poke out behind you. Those are your sitting bones, your butt bones. So the pelvic floor muscles are in between that area too. So go ahead and stand up. Now, what do these muscles do? Why do we care? Well, one thing they do is they surround those areas that I talked about. The urethra, which takes the pee out of your body. So they close that off and they open it up. So in other words, if you don't want to wet your pants, the pelvic floor muscles, we need them to work, okay? They also surround the vagina and they surround the anus. So if you have to pass gas during class or something like that, the pelvic floor muscles are part of the system that helps to activate to stop you from becoming embarrassed. It's a really, really important part of the body. Of course, we also want them to relax too. They have to relax so you can go to the bathroom. So you can use a tampon if you are having your period and you use tampons. The pelvic floor muscles need to be able to relax to allow that to happen. Now, if you feel like you ever feel real tight in this part of your body, if you feel kind of an aching or tension, or if it's really painful to use a tampon, then this is really important for you to speak up and let somebody in your life who you trust know. Maybe your parent, maybe your doctor, somebody needs to know, because there's ways to help teach you how to relax these muscles if they're chronically tight. There's a lot of reasons for chronic tightness, and we'll cover that a little bit today, but I just want to let you know that you should always be comfortable in this part of your body. If you ever feel tension or pain, it means something is off. That's really important. So the pelvic floor muscles, again, they help close off those areas and also relax to open up the areas. They relax. If you have a child one day, they're going to relax to allow for the baby to come out. They also help support the organs, support everything, and also provide stability for the core. Now, what is the core? You probably think of the core and you might think of six-pack ab muscles, like strong six-pack muscles from sit-ups or crunches. Well, it turns out that there's actually way more to the core than just the six-pack muscles. Your core is actually a group of muscles, and guess what's at the base? Your pelvic floor. So your pelvic floor is actually the base of your core. You have all of the abdominals that go all the way around, front to back. You have your back muscles, your breathing diaphragm. So actually, if you find yourself kind of holding your breath all day long or breathing really high up here, that's not very good for your core. You actually want to breathe nice and low down into your ribs, your belly, your back even, this area here. Get out of your neck and shoulders and bring your breathing down. It's actually really good for your core muscles and your core strength. So again, the core is the pelvic floor, the abs, the back, the hip muscles, and the breathing diaphragm on the top. So don't hold your breath. It's a core exercise to breathe. So integrating the pelvic floor with the rest of your core is really important, and we're going to talk about that in a second. We're going to talk about ways to use your pelvic floor in your core exercises. But first, let me tell you how to even feel your pelvic floor muscles, because when you do a arm curl, when you lift a weight, you can see your biceps contracting and relaxing. But it's really hard when you're looking in this part of your body. I mean, you can't see that. You can't see those muscles that are in there. And so what you're going to have to do is really feel. So I'd like for you to take a second right now and just feel these inside pelvic floor muscles. You can't see them. You're just going to have to feel them. I'd like for you to try feeling like you're stopping passing gas. Just feel that squeeze and lift around the anus area. Now, it's really important that you're not just squeezing your butt cheeks. So if you're seeing something major happen like this, that means you're not doing it right. If it's like this, what you want to do is feel like you're using those inside muscles I just was talking about to stop the passing of gas or to stop the flow of urine. It's a squeeze and a lift. Now, if you feel like you're pushing down, that's not right either. What we want to feel is a squeeze and a lift, and then the most important part is that you feel a complete release and letting go of those muscles. All right, give that another try. And I want to tell you, as you're practicing that, I want to tell you that you may hear in the future, especially if you ever decide to get pregnant and have a baby, you might hear about Kegel exercises. So Kegel exercises, that's the common term for a pelvic floor contraction and relaxation. It can be a useful exercise for some people, but just know that it's only one type of pelvic floor exercise. There's lots of ways to use your pelvic floor to strengthen your pelvic floor and to work on mobility of those pelvic floor muscles. And I'm going to show you some right now. Basically, we're just going to integrate the pelvic floor into other core exercises that you already do anyway. That way you're not having to go do extra Kegels. You're just doing them in your normal daily living and daily exercises that you do anyway. It's going to keep you safe, and it's going to actually make you way stronger and more stable and a better athlete. So if you are in sports or anything like that, you want a strong core. Well, the pelvic floor is the base of your core, as we've already talked about. So you need to know how to feel that your pelvic floor is turned on and engaged, and then of course relaxing when you're done, so that you can have the strongest core possible. So let's talk about that right now, about how to use our pelvic floor throughout the day. But please hear me when I say that I'm not intending for you to keep that squeeze and lift feeling, that like you're stopping passing of gas. Don't do that all day long. I mentioned earlier that if you have pain, or if you ever feel like you're too tense or tight, or if it hurts to put in a tampon or things like that, that means that you probably have too much tension in this part of your body. You might be accidentally kind of squeezing those muscles or squeezing your bum, or maybe you kind of stand with bad posture, and that can definitely cause tension in your pelvic floor too. So stand nice and tall. We don't want to stand like this. We want to stand tall. We want to be relaxed. Your good posture is going to keep the postural core muscles at their perfect level of tension that we want. It's not going to make them overly tight and tense. It's going to be just right. If you stand with good posture, then you're good. You don't need to worry about extra activating the pelvic floor unless you're doing some of the things I'm going to tell you next. So these are times when you want to use the pelvic floor a little more than normal. So a little extra. You want to turn the muscles a little extra on. Let's practice it together. The first thing I'm going to share with you is lifting weights. So you can also just think about lifting a box off the floor. This is a time when you will want to activate those muscles extra. Before we do this technique, I'm actually going to take a moment just to show you another model of the pelvic floor muscles and show you how this is the muscles from the inside. Like if somebody was going to be actually inserting their finger during an examination, like at the gynecologist, if they were going to examine your pelvic floor muscles, this is what it would actually look like. I'm going to show you. So this is the inside of your pelvic floor right here. Okay. This is going to be as if a doctor is putting their finger to feel your pelvic floor muscles. I want you to see this so you can see what it looks like to actually be contracting the muscles. You can feel as if you were squeezing and lifting around a finger. That's another way to think of the contraction of the muscles, okay? So this is the vagina, and then this would be the anus. Now, boys have a pelvic floor as well, but they only have, the anus. So this is the male pelvic floor, and they have the same muscles too. But I show you this model just so you can see, kind of get another sense for what it's like to squeeze and lift the muscles and then let them go. All right, let's go ahead and try again with the lifting technique. So if you're gonna lift something off the ground, I want you to be sure that you don't just hunch over to grab it. So try this with me. I want you to feel like you're gonna lift a box off the ground. Just pretend if you don't have something nearby. Bend your knees and hinge at your hips so that you get close to the thing you're gonna lift up. Again, you don't wanna just hunch over. Bend your knees, bend your hips. This is gonna protect your back and prevent back pain, and it's gonna keep your pelvic floor nice and supported and lifted so it doesn't get weak and you don't have accidents later on down the road. So you're going to engage that pelvic floor just like we talked about, that little squeeze and lift of those pelvic floor muscles. And gently your abdominal muscles will draw in a little bit too to support your back. You're going to exhale as you lift the thing off the ground. So exhale. The exhalation helps activate those deep abs as well, the deep abdominal muscles and the pelvic floor, and it prevents a buildup of downward pressure on the pelvic floor. So that's all you have to know. Exhale with exertion, and be careful that you're really bending at your knees and your hips and you're not rounding your back. So that's a key for lifting stuff off the ground. Now, let's lift weights. Okay, these right here are 12-pound weights. I want you to pretend like you're at the gym. It's kind of the same thing we were just talking about. You don't want to have bad posture, so you don't want to round your back. You want nice tall posture, knees slightly bent, hips slightly hinged, nothing crazy. But you're going to be active through your core, so gently lifted through your pelvic floor, gently drawn in through your low abs. So you're really stable. This is one of those times, just like lifting a box, when your pelvic floor and core muscles are going to be extra on. So you're nice and engaged, and you're going to exhale with exertion. So that means exhale during the hard part. So here we go. And then release down. Now notice how I'm slightly bent at the knees, slightly bent at the hips, and I'm lifted through the pelvic floor and the core. And I'm exhaling with the hard part. And then down. All right, that's gonna really help you during PE, during weightlifting class. It's gonna make you be stronger with your lifts and definitely safer. All right, I'm gonna tell you another tip now. Okay, come on down to the floor. We're gonna talk about sit-ups and crunches and also sit and reach, like hamstring flexibility. These are all tips that your pelvic floor can help you be better at, these moves. And I know that there are lots of people who are training for volleyball, softball, whatever it may be. And this is going to make you train better and be safer and more comfortable and a better performer athletic-wise. So the first thing is, let's talk about crunches and sit-ups. This is a really common exercise that a lot of people still do for their core. But I want you to know, first of all, there's lots of other ways to work your core. But if your coach or whoever is having you do crunches and sit-ups, just know it's really important to keep a few things in mind so that you're keeping your pelvic floor muscles safe. Because we've already talked about how important they are. But if you're not engaging your pelvic floor muscles when you do your crunches, you're actually going to be putting the pelvic floor muscles really at risk. And so it's very important to be supporting yourself from the pelvic floor on up during some of these super common exercises like sit-ups and crunches. So let's go ahead and show what I want you to do for your crunches when you are doing them in PE class or when you're training for a sport. So for a crunch, what I don't want you to do is just to crunch up and to let your belly pooch up as you do this. Now, when this belly pooches up and you're just kind of like crunching like this, first of all, it's not toning your belly the way you want it to. The other thing is it's putting a lot of downward pressure on your pelvic floor and your pelvic organs. So what you want to do is you want to do that contraction of your pelvic floor, that Kegel contraction, the squeeze and lift of your pelvic floor first. Naturally, that's going to help activate the low abs, but you can also pull your low abs in as well. So feel that area down here, like strong, strong, strong. Scooping, pulling in and up. So it's not just a squeezing in of your abs, it's starting at the bottom. It's starting at the pelvic floor and pulling in and upward. That is the sensation we want, pelvic floor first. And then from there, I also want you to be sure that you're exhaling, you're breathing out as you crunch. So just like before, we exhale with exertion. So go ahead and then down. Now notice how much better that looks for my abs too. My abs aren't pooching up, they're actually in the whole time. They're nice and strong. I'm working the right muscles. I'm working the whole core. And because I'm exhaling as I crunch, that's preventing that buildup of downward pressure. So it's going to keep my pelvic floor strong and also safe, and it's not going to make it weak over time. I want to give you an idea of why we want to do it this way. So if you're doing crunches or sit-ups and you're not engaging your pelvic floor first, it's kind of like if you had a full toothpaste tube. So picture you had a full toothpaste tube and pretend like the cap of the toothpaste tube is off. And then I want you to bend that toothpaste tube in half or squeeze it around the middle. What happens to all the toothpaste? it comes out of the toothpaste tube, right? So you want to cap off that toothpaste tube before you squeeze it around the middle with a crunch or something like that. If you don't cap it off, all the toothpaste is going to come out. So that's why we want to engage our pelvic floor first, why we want to think about our pelvic floor and activate those muscles during things like lifting a box, lifting heavy weights, doing crunches, doing sit-ups. Really, really important. Okay, so the next thing I want to show you is that engaging your pelvic floor and your core the right way can also help you with your flexibility too. So if you ever have anything like a sit and reach or forward fold of any type, it's really helpful not to just kind of flop forward and have your belly just be here. That's not very good for your back. It doesn't protect your back, and it also can put a lot of downward pressure on your pelvic organs and your pelvic floor. So it's the same thing as before. Anytime you're bending forward, I want you to think about hinging at your hips, so not just rounding your spine, but actually hinging at your hips and keeping your back flat. And I also want you to exhale. When you breathe out, that helps activate your pelvic floor. It helps activate your deep abdominals. All of this helps protect your back, and it also helps relieve the pressure. It prevents a buildup of downward pressure on your pelvic organs. So what you want to do, try it with me, is you want to exhale all the air out, feel that lifting that you have, and then fold forward. So that's going to be a lot easier, and you're going to actually get farther. You're going to feel a lot more supported, and it's better for your body and your pelvic floor than if you were to just go like this. It's a big, big difference. So again, exhale, lifting the pelvic floor, and then hinge forward at your hips. Don't just round. It's surprising how often you're going to use that throughout your day. Anytime you bend forward to pick something up, hinge at your hips and exhale, then fold forward to grab the item. The whole idea with these techniques is to get in the habit now, because you use this stuff throughout your day all day long. Get in the habit now so that you don't have to think about it later when you're older. When you are older, especially if you ever have children, you're going to be lifting things and carrying things all day long. And remember, anytime you lift something, you really need to think about using your core muscles the right way. And what is the base of our core? Our pelvic floor. And if we're not using our core the right way, it's like that uncapped toothpaste tube where the toothpaste just kind of spurts out of the bottom, right? We want to cap that toothpaste tube by knowing how to activate our pelvic floor.